So good afternoon, everyone, and thank you for joining us. I would just like to begin by acknowledging that we live and work on the traditional territories of many Indigenous nations across Turtle Island. While we meet today on a virtual platform, we must recognize the importance of the land and our treaty agreements. We acknowledge the ancestral and unceded territories of all Inuit, Métis, and First Nations peoples. As our Spinal Cord Injury Ontario community encompasses many geographies, we ask that everyone take a few moments of their day to find out which unceded or treated territories you may live and work on. You can use the link www.native-land.ca to learn more. And that will be put into our chat box. So my name is Julie. I'm the Peer Support Coordinator for Spinal Cord Injury Ontario in the London region. Today I have with me my coworker, Jess Freet. She is the behind the scenes co-host for me today, and she works in our Toronto region. So just a few rules of engagement before we begin. We are going to be recording this session. So if you do not wish to be seen, please ensure that your camera is turned off. We will also be muting everyone throughout the presentation just to cut down on the background noise. You are more than welcome to ask questions throughout the presentation. If you just want to use the either the raise hand icon, or you can use the chat box as well, because we will monitor that throughout also. So we have a great presentation planned today. We've got 3 guest speakers with us, who I will let them introduce themselves, but it's Renata Vaughan and Matt and Ron, who have firsthand knowledge of what it's like to use breast stacking techniques. So we will be showing some videos. So SCIO has created a series on our core tree platform called Respiratory Health. So we will be showing 3 of the videos that we use on that platform on breast stacking. And then after we show the video, everyone's we're more than happy to answer any questions and talk about what went on in the video. So Renata, if you want to go ahead and introduce yourself first.
Hi, I'm Renata Vaughan. I'm a senior registered respiratory therapist for over 35 years. I'm at the Hamilton Health Sciences Regional Rehabilitation Center, which specializes in spinal cord injury rehab. I'm also work with the ministry's ventilator equipment pool that supports the equipment for some of these techniques, not the breast stacking, but you'll see perhaps another one at the during the session today. My specialty is in helping people keep breathing and clearing their lungs, what we call non-invasively, meaning with no tracheostomies or tubes, so that they can, or even if they do have a tracheostomy, to try to clear their lungs more than just with suctioning tight techniques, more how we do it with our natural cough. So we've been thrilled that Spinal Cord Ontario has put together these series of videos that I helped participate as our lovely volunteers did to have this come together and help spread the word. So we're thrilled to show it to you today, and also encourage any feedback or questions about it. So thank you for joining us.
Okay, thanks, Renata. Ron, do you want to go ahead and introduce yourself?
Hi, I'm Ron. I'm one of the video participants, and I am also a peer support coordinator for Spinal Cord Injury Ontario. And our office is located out of Hamilton Health Sciences Regional Rehabilitation Center.
Thanks, Ron. And Matt, I'm not sure if you're on the call.
I'm here. Yeah, I'm here.
Oh, you are. Okay.
So my wife's account. Sorry, I apologize.
That's okay.
Yeah. I'm Matt. I've had trach for the last 20 years. Just got closed on November. So like Phil as well. So yes, thanks, Renee. Yeah, it was a fantastic job. So there you go.
Okay, thanks, Matt. So now we will play the first video, and I believe this is the one on breast stacking techniques with Ron. So we'll play that first, and as I said, we can talk about it after. And if you have any questions for Ron or Renata, please feel free to ask them or put them in the chat box.
Breath stacking helps maintain lung capacity over time and helps prevent the lungs from getting smaller faster as one ages. Also, when used in conjunction with the assisted cough technique, breath stacking helps lungs build enough volume to provoke a productive cough, expelling mucus. Before you begin, if you or the person you're assisting is sick or susceptible to infection, consider using personal protective equipment, or PPE. However, in a hospital setting, whether you are infected or not, breath stacking requires wearing full PPE. In the home, we suggest you wear a mask and gloves if you have an infection. If you have paid attendants, they should always follow their organizational guidelines. To start, you'll sit upright and get comfortable. If needed, put on a nose clip to help keep the air in your lungs. Then place the mouthpiece in your mouth, holding it with your teeth and making a tight seal with your lips. Take a deep breath and hold it. With air in your lungs, try to breathe in more air as the LVR bag is squeezed gently. This will push extra air into your lungs and help them stretch. The bag should be squeezed gently 2 to 5 times until your lungs are completely full. Your lungs are full when the bag gets harder to squeeze. Remember, if you feel too full, open your mouth and exhale. Once the lungs are full, release the mouthpiece and cough. Repeat this process 3 to 5 times. You can do more if you still have mucus to clear. Take a break if you get tired, dizzy, or lightheaded. For your last 2 breath stacks, you can try to hold your breath for 3 to 5 seconds before releasing the air.
And now just hold your breath, let it out. 1,
Don't hold your breath
2,
if it makes you dizzy,
3,
particularly if you're
4,
sitting up.
5, and a slow release.
Release your breath slowly.
That's great. Did that make you dizzy, or is it okay?
That's good.
Good. All right. So we end it like that, just so that you're not ending on that cough note.
So, why would you want a breath stack? For lung health and strength, breath stacking stretches out the chest wall and lungs and helps keep chest muscles loose. It also helps get air down deep into your lower lungs to help get oxygen to those hard-to-reach lower air sacs. This helps maintain lung capacity over time and helps prevent the lungs from getting smaller faster as we age. Also, when used in conjunction with the assisted cough technique, breath stacking helps lungs build enough volume to provoke a productive cough, which expels mucus. We all produce about half a cup of mucus a day that needs to be cleared from the lungs naturally, using little hairs in the lungs called cilia. Deep breaths are part of helping with this process to move the mucus up and out towards the mouth, where it gets swallowed naturally, often without us even knowing it. Breath stacking can also be used to help increase a person's voice strength. It's worth noting, breath stacking with a manual resuscitator, a resuscitation-style bag, is the most effective and accessible LVR technique.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking with assisted cough should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do LVR breath stacking before meals, but if you can't, wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own or assist with your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough or stomach thrust may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking if you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.
Okay, so that was the technique. Does anyone have any questions about the video, about breast stacking, anything that Renata can answer, or even Ron? No questions? Yeah, Ron.
I just want to say that when I was newly injured, I didn't do any breath stacking at all. And I've just found over the past few years that I've found that when I spoke a lot, my volume of my voice would go down. So sometimes it almost sounded like I was whispering. But since I got back to breath stacking, thanks, Renata, I feel like I've got a lot more volume to talk more. And of course, it goes along with my job as well, having to speak to a number of clients throughout the day. So, just being able to do that, I do it twice a day. It's really helped me a lot.
And you don't ever get dizzy or anything, Ron, when you do it?
I'm busy anyway, so I really don't know, but I can honestly say that it makes me feel a lot better. And again, one of the things that I was afraid of is, am I going to overinflate my lungs? But I was assured that wasn't going to happen. So now it just feels much better, and I feel like I can breathe a lot better now doing the breath stacking.
Awesome.
If I can jump in,
Absolutely.
I think if people are experiencing that voice volume, I think I maybe in the subsequent videos I just saw the question pop up. You'll see the assisted cough combined, because we thought we would just introduce it. So if everybody, even whoever's online, whether you have full capacity or half capacity, your respiratory muscles can be affected in the spinal cord injury, depending on what level. So it's not just high levels, because people that have thoracic, I think it's T12 that they say and up, your chest muscles add to your volume. So if you can only take a half breath, so if everybody online right now just wants to take a half breath or a small breath and try to cough, that's what you need, the volume behind it, and that's what breath stacking is doing. But how does it help the voice? Well, I was actually going to bring, but we can just pretend with my cord. If you've ever blown up a balloon for the first time or stretched a rubber band, when you first blow it up, it's really tight, right? It's like those, especially those animal balloons, it's really hard to get the air in there. Once you get some air in there, then the balloon's easier to inflate. Well, the lungs are exactly like that. You have enough air sacs, if we put them side by side, to cover half a tennis court. Sounds, unbelievable, but it's true. And they all get tighter, because even though you feel like you're getting enough air, which you are, because we essentially can live, easily, obviously, with half a lung capacity, but that lower lungs where the air never reaches get tighter and tighter, like that new balloon or rubber band. And then you have to exert more force to get that volume or less volume. So when Ron started breath stacking again, you stretch those lungs more to where they would normally be in that nice stretchy zone or elastic zone. And then you, with less effort, can take a bigger volume on your own, hence resulting in a better voice volume. So that's one of the benefits.
I know for myself, so I have a C4-5 spinal cord injury, so a high level quad. And so if I'm in a room with where it's a little bit noisy, for me, I have to take a deep breath, get out what I want to say to make it loud enough. And then it's like, and I need a minute to, kind of recompose and get my breath back. And so it's tough. So,
right. And so things we don't think about when all the muscles are working and pushing, because you use your ab muscles too to push out, especially in a cough, but also to control how quickly that air is coming out so that you don't lose all the volume first, right? So,
yeah. Jaspreet, go ahead.
How does one know that they might need to do this? Like just me, if I am just doing a self-assessment in some way, like how would I know I'm ready? Like I know, Ron, you said that like it was the voice change. As I was watching that video prior to this, even though I was helping out and I had some ideas, I hadn't seen the videos. And I realized like I'd been told I don't take the most fullest coughs. My injury level's at about a C8, I've been told. It's a complete injury. And so I don't know. I was just curious because I don't think I have the best lungs. So when would somebody know that they should ask for this, and where do you go to ask for this?
So a start would be with your family physician, unless you have a physiatrist and spinal cord injury that you see frequently, like regularly. That would be ideal to connect you to hopefully a lung doctor. Typically, is who starts it. I would, of course, advocate. So if you look, there is another reference with the videos called CanVent. It's the Canadian for non-invasive ventilation through the Ottawa Hospital's rehab program. They had an excellent Canadian research all on it. So they suggest if your breathing capacity is lower than 75% of what it should be, because it's all based on height and age and gender. So we know, right, what your lungs should be able to blow. And if you're below that, it's like an exercise twice a day. It takes 2 minutes. You fill up 5 times, you stretch your lungs, just like you would do range on something that doesn't move so it doesn't get stiffer and tighter. We all lose lung volume after the age of about 25 years old, about a tablespoon, 25 mils a year. So we know in spinal cord, when the lungs are smaller and they don't have all the muscles, they'll get smaller quicker. And that's why we notice it over age earlier, that people will notice it. So the earlier you can start it, it's very preventative. It's kind of like changing the oil in your car, Dr. Jones always says. But if you do notice your cough is weak and those things, for sure, it can't harm you. It can only benefit you. So, and I do realize that the challenge, we would all love to go to Walmart, and I shouldn't say that on that. No advertising, but go to your local store and get a bag and stew it. But you should the first time be measured. So obviously you could be taught. But literally, most people can pick it up in, what would you say, Ron, 1 or 2 minutes when I teach it. And if you have the ability, like I have people that just squeeze the bag themselves, you can even make the tubes longer, so you can do it on your knee. I've had people squeeze it with their knees that don't have good hand function if they're central. So family doctor, some family doctors have spirometry right in their office, so that would be a great place to start. And I would say if you're less than 75% or 70-ish around that line, because then and definitely at 50% lung capacity, we start everyone. And then we also can measure the speed of the cough. It's the same as like an asthma meter. I didn't bring one today. You just cough into it. And if it's lower than 300, we tend to say, yes, you either need a push on your belly, which will show but if your volumes are low, we get people to stack. Does that help answer the question? Okay.
Yes, thank you.
You're welcome.
Okay, is there any other questions? If not, we'll go on to the next video. Oh, one sec, Jaspreet, we have a question. Yep, go ahead. NLA 95.
Sorry, I had to unmute. I'm just wondering if my lungs are okay, but the muscles are very tight and affecting things. Is that still helpful?
Absolutely. If I can jump in, it's Renata. So most people that have spinal cord injury or neuromuscular weakness, no matter what the cause, the lungs are typically always fine. They say, oh, you have low capacity. Oh, you have small lungs. Well, they're only small because your muscles can't get them. And if they're stiff, like in kyphoscoliosis, they are restricting the lung. So we encourage it because you can still stretch that lung more than your muscle power typically can. And like I said, you can't do yourself harm. The only ones we really, really caution is if you've had like someone that smoked that has very fragile, it's called emphysema. We caution, although I've done it in many of those too, but it's particular for people that either, like you said, have stiff chests or muscles or weak muscles.
What dystonias in the neck or throat or tongue have any effect on any of this as well?
Very good question. You have to try it to see about the coordination. So if you have difficulty holding your breath or coordinating the timing of the breaths, I will leave it to Julie at the end to show you. There's another device that can help people stretch their lungs that is mechanical, that you don't rely so much on the coordination.
Thank you.
Mm-hmm.
Okay, we'll go to the next video, but if there is any other questions, please ask them at any time.
An assisted cough involves the use of a stomach thrust to help build pressure to produce a cough. This video will demonstrate how to do the breath stacking and assisted cough technique while in a bed and with one person assisting. First, because the person doing the stomach thrust will be applying a forward and upward push to your torso, they'll want to decide if they're able to do that thrust with the needed amount of pressure while standing next to the bed, or if they'll need to be positioned on the bed. You and the person assisting will also want to decide how to do the breath stacking, which you'll do before the assisted cough. If you are able to squeeze the bag yourself, you can do the bagging while the person assisting positions themselves for the stomach thrust, or, as you'll see in this demonstration, the person assisting you can position themselves to do the stomach thrust with one hand while squeezing the bag with their other hand. Once you and your assistant have decided which position will work best for a good thrust, you're ready to start your breath stacking to prepare yourself for the assisted cough. Make sure to establish a signal with your assistant before starting to tell them when your lungs are full. It can be a head nod or a wave, whatever works best for you. To be ready to apply the stomach thrust after the breath stacking, the assistant will place the palm of the hand below your ribcage and above your belly button. When you're ready, take a large breath in through the mouthpiece. Hold that breath. The bag is now squeezed and you inhale with it, taking 2 to 5 successive breaths of bagged air. The assistant can count and say, "Breathe in" each time.
And breathe in.
The bag is squeezed until you cannot hold any more air. The bagger can tell this by feeling some resistance when squeezing the bag, or if you signal. Once the lungs are full, and just before removing the mouthpiece from your mouth, the stomach thrust is started. The assistant then pushes up with some solid force, but not enough to injure you.
All right, breath in, and big breath in, and
You
breathe in.
cough as the thrust is
Breathe
applied.
in.
The assistant
Breathe
can
in.
try saying cough
Breathe
as a
in.
prompt.
And excellent. Got something there? Oh dear, you actually do.
If the breath stacking and assisted cough is successful, a high flow of exhaled air will occur as the mouthpiece is removed. If mucus is loosened, you might hear a rattling sound or feel congested. Cough out as much mucus as you can and spit it out into a container or tissue. Repeat the whole process 3 to 5 times or until all the mucus is out. Rest in between cycles, and remember to clean the mouthpiece afterwards. After breath stacking and doing several assisted coughs, you should do 2 breath holds.
Breathe in again. And now just hold your breath, let it
The
out.
breath hold is
1,
done by giving you successive breaths using
3,
breath stacking,
4,
but instead of coughing at the
5,
end,
and a
you will
slow
hold your
release.
breath for as long as possible,
That's
from
great.
3 to 5
Is that what you
seconds,
did? Very
before
good.
exhaling.
That's good.
Good. All right. So we end it like that, just so that you're not ending on that cough note, right?
So why would you want to do a stomach thrust to increase the force of a cough? A cough is your body's way of responding when something irritates your throat or airways. The irritant stimulates nerves, which then send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. However, a spinal cord injury at T12 and above affects the strength of your stomach and breathing muscles, and these muscles help you to take a big breath in, and you need the strength of these muscles to produce enough force for a good cough. And an assisted cough helps your stomach muscles produce this force.
Some things to keep in mind. Not everybody needs the combined breath stacking and assisted cough all the time. If you have a cold, that's when you would add an assisted cough. Consult with your healthcare team to come up with a plan for maintenance that makes sense for you.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do breath stacking before meals, but if you can't, wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own or assist with your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough or stomach thrust may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking. If you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.
Okay, so that's it with the assisted coughing. Again, any questions after that one?
I have one if nobody else is going first.
Mhm.
I'm going to put you on the spot, Matt. So, to me, it's always a little bit unclear with when to use assisted cough, when not. Again, when we say it's healthcare, if the bagging, because your lung is fuller, because that's the first thing we do when we cough, we fill up our lungs to almost full, then we close the flap at the back of our throat so that it's closed so that we can bear down on our stomach muscles for a quick second before, so that we can build pressure before we expel it fast. And that fast speed is what moves phlegm, and it has to get behind it. So that's what the stomach push is really. People say, does it hurt? Generally speaking, no. But I'm going to look at Matt, because when you're sick, you're also more congested. So the bag alone sometimes isn't enough, or sometimes if you're just got such low levels in the beginning of the injuries, like I just got a new spinal cord person in, and they, they're saying that they're not able to clear, but it's just that they're not full enough, or they needed the added push because they don't have the speed. So Matt, when you're sick, can you share the experience of what it was like to help, if I can put you on the spot, clear?
Well, I did have COVID, pneumonia, UTI, and flu all at once. Great fun. So, well, they couldn't breast in the stomach to have an ostomy. So I kind of had to my own kind of a MacGyver thing. But I put it on my chest. They just sent me down the chair. That worked. She kind of enjoyed it though, because we pain. But no, it worked well.
So that's a good example. I mean, the push is the typical, but when people can't, some people can put their hands on either side of the rib cage and squeeze up and out, or the person, if they have the back control, can just go forward as they cough and do kind of like their own, because I don't think we have the time to show the video of Ron doing that one. But they combined, if you didn't have that, what would have happened, right?
Well, I probably would have knocked out my lungs as well, because I mean, got better within a couple weeks. It was fine. Coffee, had no sleep, of course, but
and you had to do it often, right? Very often, because
my wife, I wake up at 3 o'clock in the morning sometimes to do it. So,
so I want to point that out, because if you had a cold, how often we cough, we don't think about it because we're just coughing. So yes, it's labor intensive, but it avoids often in a hospital admission, and or worst case, having a breathing tube put down, because it is unfortunately one of the leading causes, right, of people getting into life trouble when they have a respiratory infection, right, next to the UTI and skin. So if you can clear it on your own, and of course get medical treatment when you're sick with an antibiotic from your doctor or whatnot, it's just arming you with a technique when you're unwell that you wouldn't have had otherwise. And doing it on a regular twice-a-day basis will just keep you well practiced in it, right? Versus, how did I use that? Where did I put the bag? So, yeah.
I have to leave at 3:42. Especially put me in an appointment today at 4:30. So I apologize.
That's okay.
Early, I apologize, guys, but I'll be gone at 3:40.
But I think that's a really good example. Personally, thank you, because I know that right was really a challenge.
Yeah, it was a rough couple weeks, I tell you. So, like she's been killed. Wife didn't kill me, so I'm lucky I'm still alive.
It's good. Good. Thank you.
Okay, is there any other questions? Otherwise, maybe we'll just go on to that third video. Okay, go ahead, Jaspreet.
An assisted cough involves the use of a stomach thrust to help build pressure to produce a cough and expel mucus. In this demonstration video, you'll see how the breath stacking and assisted cough technique is done while seated in a chair with one person assisting. There are two ways to do the breath stacking and assisted cough technique. If you are able to squeeze the bag yourself, you can do the bagging while the person assisting positions themselves to do the stomach thrust. Or the person assisting you positions themselves to do the stomach thrust with one hand and squeezes the bag with their other hand. First, because the person doing the stomach thrust will be applying an inward and upward pressure to your torso, it's important to be sure your chair is placed against a wall and the wheels are locked, so the pushing pressure doesn't cause a tip. You may want to place a pillow behind your head if you don't have a headrest to avoid hitting the wall. Once your chair is secured and you and your assistant have decided who will squeeze the bag or be the bagger, your assistant will get in position, facing you, ready to thrust after the stacked breathing. The assistant will place the palm of their hand below your ribcage and above your belly button. Before starting, make sure to establish a signal with your assistant to tell them when your lungs are full. A head nod or a wave, whatever works for you. When ready, take a large breath in through the mouthpiece and hold that air. The bag is now squeezed 2 to 5 times, and you inhale with each squeeze to give you successive breaths of bagged air. The assistant can count and say, "Breathe in," on each squeeze. Once the lungs are full, and just before removing the mouthpiece from your mouth, the assistant then pushes up with some solid force, but not enough to injure you. Then make yourself cough as the mouthpiece is removed.
Breathe in and cough.
Your assistant can try saying cough as a prompt. If the breath stacking and assisted cough is successful, a high flow of exhaled air will occur as the mouthpiece is removed. If mucus is loosened, you might hear a rattling sound or feel congested. Cough out as much mucus as you can and spit it out into a container or tissue. Repeat the whole process 3 to 5 times or until all the mucus is out. Rest in between cycles, and remember to clean the mouthpiece afterwards. After breath stacking and doing several assisted coughs, you should do 2 breath holds.
Breathe in again. And now just hold your breath, let it
The
out.
breath hold is
1,
done by giving you successive breaths using
3,
breath stacking,
4,
but instead of coughing at the
5,
end,
and a
you will hold
slow
your
release.
breath for as long as possible,
That's
from
great.
3 to 5 seconds, before exhaling.
That's good. Good. All right. So we end it like that, just so that you're not ending on that cough note, right?
If there's no one available to assist you, you may be able to assist yourself to build pressure to help you create a productive cough. To do this, after breath stacking, place your arms across your stomach, then push in and up or lean forward as you cough. Or you can use a sturdy table or desk to help stabilize yourself to build enough pressure. First, with your legs and arms positioned underneath the desk or table, push your shoulders back into your backrest. Then, leaning over the desk or table, bend forward to help put pressure on your abdomen, cough, and then press your shoulders back again, lean forward again, and cough again. This will help create a productive cough.
So why would you want to do a stomach thrust to increase the force of a cough? A cough is your body's way of responding when something irritates your throat or airways. The irritant stimulates nerves, which then send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. However, a spinal cord injury at T12 and above affects the strength of your stomach and breathing muscles, and these muscles help you to take a big breath in, and you need the strength of these muscles to produce enough force for a good cough. And an assisted cough helps your stomach muscles produce this force.
Some things to keep in mind. Not everybody needs the combined breath stacking and assisted cough all the time. If you have a cold, that's when you would add an assisted cough. Consult with your healthcare team to come up with a plan for maintenance that makes sense for you.
So, when should you use the breath stacking and assisted cough techniques? To keep your lungs healthy, breath stacking should be done 2 to 4 times a day. Your respiratory therapist will set up a care plan that best suits your needs. In times of an infection, breath stacking and assisted cough may be done as often as every 10 minutes. It's best to do breath stacking before meals, but if you can't, wait at least 30 minutes after eating. This will help reduce the risk of nausea and possible vomiting. You can even do your own or assist with your breath stacking and assisted cough if you're able to squeeze the bag and apply your own thrust. Finally, the assisted cough or stomach thrust may be used at any time to help move mucus. Your respiratory therapist can advise you if routine stomach thrusts should be used.
Do not do breath stacking. If you feel lightheaded, feel any chest discomfort, have an upset stomach, or are experiencing low blood pressure. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started.
Okay, so a little different, I guess, when you're in the chair as opposed to when you're lying down in bed. Is there any questions or comments after that video? Yeah, go ahead. Sorry, I don't know your name. It just shows NLA.
Sorry, it's like I don't know why
Yeah,
it doesn't
no
show it
problem.
correctly. What was my question? How easy is it to know or feel that you're full?
Oh, full from the breast stacking, you mean?
Yeah, when you're full.
Oh, you'll totally know it. It's just
Okay.
it's a natural feeling. People, I love Spinal Cord Ontario. They released we have a few, I think it's 8 or so questions or myths. And the first one that's come out on Instagram was, will it blow up my lungs? So the beauty of having a mouthpiece in your mouth. So if someone squeezes, one too many, you just open your mouth. It's like a balloon, right? It would just your mouth acts like a pressure valve, and you won't let yourself. It'll just come around your lips. It quite frankly, if you even tried to hold it, your lip power probably wouldn't be strong enough to overcome the pressure, and it would just blow out. And then initially when people start it too, especially because I always have the question that, I've been injured for 15 years or whatever, is it too late? We don't know how much lung function you can regain, not meaning regain, you haven't lost, it's just how much can we access. A lung sac is actually like a really stiff balloon once it's down. And that's what happens in pneumonia, or when they say, oh, you've got fluid, it's often consolidation, but not fluid, the words we use, but that, that lung has been collapsed. Especially if you have to be on skin rest or whatever, that's really important, because you're not getting up as much or whatnot. That first time to get that little air sac open and pop it open, it takes quite a bit of force, because the good side that is more open is going to take all that air, right? So we find that, and then once it's open, it needs about 24 hours to kind of keep itself open. And then, and that's why after time, when you get more air sacs open, you'll find you can take another half squeeze or another full squeeze than you did when you started. And we'll actually see people's lung volumes on breathing tests come up after time on their own. And that's part of that elasticity and also recruiting more lung. That's why we call it lung volume recruitment, for recruiting that air sacs that have kind of shriveled up, for little lack of better terms. And when you're squeezing it, often in the beginning, people will let go a little bit easy because they're used to feeling where they're full, but you're really not your real full, if that makes sense. And then it comes, and then you can see, I don't know if you noticed in the videos how with each squeeze, the chest comes up a bit, and that's why, right, that's what I look for, and I know I'm getting more air, and then when the person can breathe in on their own.
Thanks, Renata.
I have a question for Ron. Ron, how did you figure out your table technique?
One day I was just home alone, and I always used to have somebody push on my diaphragm to help, get the mucus up. But I was experiencing a cold, and there was nobody around. So I just know when I try to cough, sometimes I have my arms up my side, and I kind of push as much as I can. So, and again, I wouldn't recommend this to people that don't have good balance, but I just was leaning over the counter or something in the washroom, and I just gave a really good cough, and it helped. So ever since that day, I just started using that technique, and it's really helped.
So,
Can I just mention too, it's more of a comment than anything. I'm just really glad that SCIO and Hamilton Health Sciences partnered up for this topic, because I think breathing is one of the things that's really overlooked unless you're affected by it. And I think that, we all should be aware of these issues because, again, we're looking at long-term, lung health. And if we don't take care of them, before you know, we're going to run into, risky situations where, we may have to be medically induced and stuff like that, have a breathing tube. So it's really important to, take care of ourselves.
Thanks, Ron. That's so well put.
I agree. Which might be a good little segue for me to say, to let you know what I use. So, I have been injured for 24 years, and I was about 10 years after my injury before I actually got a cough that was phlegmy. And it was really startling because I didn't know what to do, and I felt like I was choking and I didn't know how to get it up. So I ended up calling an ambulance, and then the EMTs showed whoever I was with how to do the assisted cough. So I started to do that, but I can't do that on my own. So I needed someone with me basically 24/7 because I felt like I had to cough like every 5 minutes or something. So so I had to make sure that someone was around. And I did find after doing that assisted cough so much, it's like, although it doesn't hurt you to do it, I just felt bruised and that kind of thing. So I ended up going to a respirologist, and they got me hooked up with a cough assist machine, which we do have a video. So once I started to use the cough assist machine, I was able to now, if I had a phlegmy cough, use the machine and get the phlegm up on my own. So I didn't need any assistance anymore. And I didn't have to do the assisted cough. So if we want to maybe show the video just so that everyone can get an idea of how it works or what it looks like.
Exhalation cycles, followed by a rest period as prescribed by the healthcare provider. Repeat the inhalation and exhalation cycles, followed by a rest period as prescribed by the healthcare provider. Remember to allow the device to provide inhalation pressure one last time before starting the rest period. When the therapy session is complete, turn off the cough assist device. Encourage the patient to breathe deeply and cough or huff cough. If the patient has a suction machine, use it to clear secretions from the trach tube or back of the throat if needed. Regularly clean cough.
I think that's where we were stopping it. Just to
That's right.
Yeah.
Perfect. Jaspreet. Absolutely perfect.
So I don't know, Renata, if you want to sort of give the kind of how it works part.
Sure. So it really is a form of breath stacking for people that either can't coordinate the each breath and hold it in between, because perhaps, like I was saying, your question was earlier, the dystonia, if you have coordination issues or weak bulbar, what we call throat muscles, it will, and you can do it by mouthpiece too. You don't have to do it by face mask, but just it's a more natural way to cough. So you take a big breath in, which is basically the mechanical way of squeezing this, and then it quickly switches to a negative pressure or a vacuum. And it helps speed up the air on the way up, which is what we would do with the push and the cough. Now, you can still use the push even if that isn't enough, because some people would need that. And it also lends to independence if you can't squeeze the bag yourself and you don't have someone to help you with that, family or attendants or otherwise. So now, again, much less expensive and easy, to use and relatively easy to get. The other one has to be prescribed as a formal, assessment through a respirologist, as does the breast stacking, but I mean, then applied to the ministry. In Ontario, at least, it is funded if you meet those criteria for the levels for the cough machine to be lent to you on permanent loan until you wouldn't need it anymore, or you would move away out of the province. But basically, the machine mimics the three things we do to cough: big breath in, and then a fast air out, which is the air, the cough part. And you'll notice she said at the end, and with an inhalation, that's just like that breath hold. So the reason we do that is when we always are coughing, you can close little air sacs, just like the negative pressure that's pulling the air out. So that's why we always want to end with a breath in, just like a yoga breath. I call it big breath in or a sigh. And if holding your breath makes it dizzy, that's a couple of things I wanted to say. When you hear, oh, if it makes you dizzy, why does breath stacking potentially make you dizzy? Well, one, you're taking a deep breath, and that anybody, if you take a deep breath on your own and hold it, you can put some pressure around your heart, and you can make yourself dizzy from your blood pressure dropping a bit. And if you do, like a lot of people, they'll do one after the other. When they say wait, some people wait 5 seconds in between each one, but if you do them too quick, you're taking big breaths. So it's just like hyperventilating. So especially when you're sick, if you do, like if I get to about 15 rounds of breath stacking, I just give it a break for 5 minutes and come back if the person needed more, because I don't want to overventilate them, and that can just naturally make you dizzy. And anytime when you're sitting up or standing up, we always have a slightly lower blood pressure, especially it would be in the spinal cord. That's why if you can't hold your breath in your chair, because don't hold your breath in a chair versus lying down, just because you might be more prone to. So if you feel lightheaded, just don't hold your breath. Just let the air straight out, but you just don't want to end on that pushing cough note. And as far as eating, I call it my swimming rule. It's not that you can't do it right after you're eating, inducing nausea and vomiting. It's just if you happen to swallow some air and you're full, you don't want to, right? So that's why we just say for regular use, always try to time it before or wait a little bit after you've eaten. And that's why you don't want to do it if you're already feeling nauseated, because you don't want to get air into your belly. Not that you technically should, just in case it would go there. Does that help? Any questions about that?
Thanks, Renata.
Mm-hmm. And a lot of this is what we're trying to do too, is a lot of ERs, when they can't, breast stacking isn't enough and you have a cold, sometimes people would have to step up to a device like that. And essentially it was invented back in the polio era. I love history, just to share that. A fella, they couldn't cough in the iron lung, and a fella named Jack Emerson took a vacuum cleaner and he put a positive side on it. And he had a switch, and he put it to a mask, and he helped people inflate and then quickly switch. You'll notice on your cough assist, there's a little switch. That's the manual way. And then you put it to the minus, and then it pulls the air out. And he helped people clear the lungs. And thank goodness to them, because they've kept it going all these years. And now we have these techniques to pass on. Of course, they've been, digitalized and, that made more modern, but it's still loud, right? So.
Very interesting. I didn't know that.
Yeah, that's how it all came to be. So, and that's before tracheostomies were invented, right? And then when they came into play, people forgot about these techniques, and they just go to, and these are very intrusive, invasive, right, procedures that we all would like to avoid, that come with their own risks. And, for all of people with spinal cord, it's always a risk going into hospital for your other body systems, right? Particularly in programs that aren't specialized in spinal cord. So they don't know about your skin, they don't know about your turning, they don't know about your bowels, and then they put you in bed, and then your lungs get worse because you're not moving around, or your chair is not there, or they don't know how to get you up. Anyways, on and on, right? So the more maintenance you can do, I always say, a few squeezes goes a long way. Keep your lungs healthy. It helps maintain that lung function. A lot of people like to say, hey, I don't want to lose my volume, and it helps, right, maintain it as it would have been had you not had any kind of muscle weakness from whatever the cause may be.
Mm-hmm. Mm-hmm. I just have a question for the group, if anyone's comfortable to answer. Does everyone here do breath stacking, or did you come on the Peer Connection just to learn more about it? That's okay. You don't have to tell us. I was just curious, because we do these thinking, right? We just want to get as much information out there. And as Ron said, this is an important one that's just seems to be probably overlooked quite a bit. And even as you're
Yeah.
saying, Renata, right? Like
Yep.
you think of skin and bowels and all those kind of big
Yep.
issues, whereas breathing is just as big, but for some reason, yeah.
Thanks, Christine, for being here to learn. The other thing that I find, like when you had someone, I don't know, fortunate that referred you, right? When you were saying you felt bruised with all the assisted cough, it's both for the caregiver and the person. If you're getting to do so much, it gets fatiguing sometimes, and you need that little bit of, right, that help. But people do that without, they don't have the breast stacking. They're forever doing the assisted cough, which is when I came into my early career and everybody was exhausted and their shoulders were sore and the person was exhausted. And then they would give oxygen. And oxygen is a bad thing in the sense that it masks what's happening. We all make about a half a cup of phlegm a day and our little hairs sweep it up. But if we can't take a deep breath to move that to where the hairs are, it can get plugged and stuck and you can get mucus plugs. And that's how the pneumonia happens or can happen. And then if you're sick already and that happens and they're giving you oxygen, it's just masquerading while the pneumonia gets worse because you're not clearing that phlegm until it's really hard to breathe. And then you're really getting behind that 8 ball. So, and then fluid intake is always important too, because the mucus can get really sticky, because if you get dehydrated, it robs it from the phlegm too. So it really is arming you with that technique. So the more you can advocate for yourself, because a lot of people say, oh, you don't need that. You can just, and they'll put you on oxygen if you had to go through ER, or a lot of emergencies don't know it. So that's why it's really trying to advocate for yourself to get to that. Or if you do have a link to a physiatrist, to reach out to them to say, hey, I'm not well. Can you help me get some assistance with respirology to refer? Because I have to say, over the years, that part is getting better, because I think it's all in the now more and more in the training of them, so they know that there's that recruitment, right, requirement, and getting that, and the tools should be readily available. Whether we didn't talk much about it, but it's all on the links. There are the pre-made bags that come with the actual valves put together, and then or they can be done separately. That's what you see in the video where I just put mine together. And basically the purpose, when people get really, really good at it, they don't even need the valve, but that's like the flap, so that the air doesn't come back out. It helps you hold your breath. And then we put a second one over it or after it to act like a safety catch, so that this little valve that's inside doesn't fly out through it into your mouth. And I have to share this specifically with Tori being on the call that helped with the videos. We always said this is the catcher to do this. And I had someone come in, I just said the other day, and believe it or not, they had it in the wrong order. And I was just testing the bag and squeezing it, and out flew the valve. And a nurse was there and said, oh my gosh, I would have ended up in their mouth. And sure enough, so just make sure, we just call it the safety catcher, and something's after it. You can customize how long this tubing is, so that if you can squeeze it with your knees or even under your arm to reach your mouth, you would just do this and then put it to a bag, just to show you. I could breast stack myself. I used to do this in teaching, and then now with COVID, no one does it now. And that's it. And that's, and you don't have to wear the nose plugs. Some people leak through their nose just naturally. They can't close the palate. I always use it when I teach. And that's it. And that's usually how quickly it is to learn it. It's just, right. And I've had to stretch. I can stretch my lungs probably higher than, even my own muscles can take me, because the lungs can take it, right? So that's as simple as it is. So I really encourage people that if with your level of injury, you're likely not having your full capacity reached, or if you've ever had your lungs tested for your volumes, is just, ask how you can get that. We do it in Hamilton, Toronto area. Maybe SCIO Ontario can be an excellent resource on how to, hook you up with somebody that can get you the technique started.
Awesome, thank you. We've got 2 hands up. Jaspreet, go ahead.
Maybe we've had this question answered. I know learning it is easy to do, but if you require someone to assist with the pushing part, is that something that I could learn once and then teach attendants or others on my own, or would they need to be taught by somebody
Ron, what's your experience? I can answer. I'll let Ron answer first.
I think I've been very fortunate because I've had some really good staff that they just catch on quite quickly, and it's
So you
pretty.
teach. Sorry, you teach them.
Yeah.
Okay.
But again, having an expert like Renata really helps too. But hopefully that we learn, from her educating us to be able to, teach somebody else to do it. And I don't really think that there's a lot that you can do to mess it up, because again, just being in control of squeezing the bag properly, and you, the person taking in the air properly.
What about the assisted cough though, Ron? Are you able to direct someone if they had to push on your belly to do the assisted cough if you needed it?
Yeah, it's pretty straightforward, just making sure that I have them place their hand in the proper position and push.
Yeah. So it's much like the Heimlich maneuver. So if someone taught you once, just so that you would know, Jaspreet, I think that would be really, helpful. It is exactly like the Heimlich maneuver. So if anybody knows CPR, it's like that. Most times people do it too gentle. I will say that, and I'm not even in the videos there. Although I'm doing it, as you can see, I produced phlegm, which I actually think I surprised because. But the other thing people say is, "Oh, I don't have phlegm." Well, you don't know if you do or not unless you get air behind it or the speed to move it. And surprisingly, it wasn't acting. The secretions came up, and I'm like, if you heard it there in the video, and I caught it with the tissue. So you just have to make sure you're off the rib cage. That's the most important part. And there are some contraindications, like if you have a hernia, if you have kyphoscoliosis, sometimes it's a little bit, it depends on how severe because your organs have moved a little bit. So that can be a caution. Or if you have any kind of aneurysm, you don't want to push in the belly area. Obviously, Matt's shared, he's gone now, that he has a colostomy. It's not a total contraindication, it depends where it is, right? So, in feeding tubes, often people ask you that. It's not a contraindication, it's just if the surgeons place it in an awkward position, it might be in your way physically. And obviously, if you're nauseated, most people don't feel like you're pushing on their belly. That's why sometimes the rib cage one can do it. So you can definitely direct. I find most of the people that I've taught have to direct people just to do it with a little bit more force. So it's in and up. It's not just in. So think about it. When we cough, we push our stomach muscles up into our diaphragm to help expel that air quicker. So you're just trying to mimic that same motion where you're going in and up. And yeah, so it's hard to tell in the video, but you keep your fingers off. You're using the heel of your hand so that you don't push accidentally with your fingers. And some people use two hands and cross just for more force if they are weaker or smaller. And when they say, or some people get right on top of the bed if you're doing on the bed so that they can actually straddle and use their body force versus, and that's more for people that are doing it all the time. Although I've always done it with my shoulder. My shoulder's been fine. Fortunately, some people say lock the elbow and use your body weight so that you're not using so much of your shoulder. Mm-hmm. You said there were two. Was there another question?
Yeah, there's one more question. Yeah.
I'm sorry, I was just going to answer your question. I saw the word lungs and I had to come and learn because just barometer changes, pressure changes, and I just feel squeezed.
Oh, yeah.
And it affects my lungs. So
yes.
The whole torso. Yeah.
Mm-hmm.
And there's nothing I can do about it. And I just had to come check it out.
Oh, okay.
Could this help that too?
Well, it depends on why you're feeling it's squeezed or tight, I guess.
Just
if you don't mind.
Pressure changes. Just the pressure changes with storms and.
Oh, I wonder what your volumes would be to begin with, because yes, when people
They're about
are
98%.
Oh, interesting. Okay.
And that's with asthma and allergies.
I'm sorry, that's with what?
With asthma and allergies.
Yeah, so I would take it. It's more those two. I was just going to ask you if you had any, without, again, you didn't have to answer asthma or allergy type symptoms because that's definitely you know, something that hopefully you're seeing a respirologist or an allergist
Oh, yeah.
for, yeah, because it's usually a medication thing, because it's exactly that, right? It's feeling tight, but not for lack of air volume. So it's not something typically that breast stacking, because when you're already at that full percentage, we're not going to we definitely don't want to overinflate you, right? So you're ready, and especially when they're tight, because this is, I should say, is for, that's why in things like emphysema or like asthma, where you have airflow that's got difficulty moving because of the size of the air tube, pushing more air in isn't going to help the speed, right?
Okay.
Yeah, it's a mechanical thing for muscles that can't get the air in because they're too weak.
Gotcha. Thank you.
You're welcome.
Does anyone else have any questions? I know we're a little bit over time, but if there's any sort of last minute questions anyone has? No? Okay. So this is recorded. It will be on our Cortree page. And I think Renata sort of had mentioned that there is other videos as well included in this respiratory health series. So cortree.com is the website if you want to go check it out. And there is lots of other cool videos and series on Cortree as well. So it might be worth it to go and check it out. So thank you all for coming. Thank you, Renata. Thank you, Ron. I know Matt's gone. Thank you all for your questions. If you want to find out any events or our future peer connections, check out our website at sciontario.org. Enjoy the rest of your day, everyone.
Thank you so much, everyone. It was a pleasure. Take care.
Thank you.
Breathe well. Cheers.
Thanks, you too.